Okay, everybody, welcome back. We are at the Newcomers Community Forum. It is June 24th at 2:05 p.m., so we will get started. Today, we have Sanela with the Hawkeye program through Blackhawk County Public Health, and she's going to be presenting on the Hawkeye program, some specifics on insurance in general, and just to answer your questions too. And I believe it's going to be more of like a conversation piece. So at this time, I'll turn it over to Sanela. Sanela, did you want me to share those slides now, or do you want me to wait on that?
You can share them now. That's okay too.
Okay, so let me get a few ducks in a row here. All right, and let's see. There we go. Okay, can everybody see that okay? Awesome. And I do have closed captioning or subtitles or whatever you want to call it at the bottom, so that's fun. So hopefully it gets what I'm saying out there. But yeah, okay, Sanela, I will let you take it away, okay?
All right. Hello, everyone. And again, my name is Sanela, and I am Hawkeye Outreach Coordinator for Blackhawk County, Bremer, Buchanan, and Grundy counties. County. I'm not sure how many of you have heard of Hawkeye Insurance. Hawkeye is a healthcare for children and teens that offer free or low-cost health insurance. It is an affordable option for working families that make too much for Medicaid but do not have or cannot afford private insurance. And just to say, if you guys can just jump in anytime and ask questions while I talk, no problem. So Hawkeye also has dental option only. So like if your kids, if they're like they offered they have a dental, they have a a health coverage, and you just need like dental, they can do that. Like you can apply, it would be the same application as Medicaid. It would just like show dental only plan. So even if your child already has medical dental coverage, you can still get coverage through Hawkeye. Dental coverage is provided by Delta Dental of Iowa. And the difference between like Medicaid and Hawkeye would be that Hawkeye dental plan is limited. So I think it's about like $1,000 a year. So, and again, like I said, to apply for dental only, complete like full medical application. If all eligibility requirements are met, child will be automatically put on Hawkeye dental plan only. When it comes to income guidelines, Hawkeye income guidelines are higher than most people think, so many families qualify and don't realize it. For example, a family of 4 that makes between $46,344 and $83,808 per year would qualify. The cost of Hawkeye, for many eligible households, there's no premium, so the cost is $0. For others, the cost is $10 per child per month, or no more than total of $20 per month per child, and no family pays more than $40 per month. So if you have, let's say if you have more than 4 kids, you would still not pay more than $40 per month. And Tracy kind of posted, I'm sorry, I can't see any posts. So she posted the income guidelines, so you can kind of look at it and get an idea. Another thing, with part of Hawkeye, there's a presumptive eligibility, and presumptive eligibility is a temporary health insurance that lasts about 30 days. It serves as a dual purpose of providing immediate access to needed healthcare services while putting people on path to ongoing coverage. So if a child doesn't have medical coverage, I can help by applying for presumptive eligibility benefits. For example, your child needs medical coverage, I can complete applications, and if child qualifies, then coverage would start that same day and last for 30 days. Meanwhile, you're waiting to find out if they can, or if your child can qualify for ongoing Medicaid. So if, and we can do that, like it would be like same day response. And of course, there's a question if you want to apply for ongoing Medicaid, and if we put that, then child would be covered, so there wouldn't be like a gap in between, like child qualifies for Medicaid while you're waiting technically. Any questions about presumptive? There's so much to it, but I hope that if you have questions to ask me.
I should also add that if you feel more comfortable typing something into the chat box, that's totally okay too.
Except that you're going to have to read it because I still can't see anything.
I will read it.
Okay, thank you.
And it would appear that Sanela has gotten off. We're just having some issues. It always seems that when like it's just a standard Zoom, they work fine. And then when it's an important Zoom, it's just like, hey, I guess in the interim, I'll just kind of discuss health insurance in general and more specific to children. Here, I'll just stop my screen share real quick. Okay, yeah, so there's a question in the chat. So we'll get that question answered when Sanela hops back on. But it always seems that children will get sick when it's like least convenient for you. But also kids get sick a lot, especially when they're little. And that's why like proper insurance for those kids is very important, because medical care can be very, very expensive. And then medical care aside, dental care can be very expensive too. So having insurance to kind of buffer the cost of that is very, very important. And so it's cool that there is the option of Hawkeye for those things. And like a lot of the times too, if you think about kids going to daycares and stuff, like they're just going to get sick, and that's just kind of how their bodies work. And some parents are more likely to take their children to a doctor than others. I know when my little babe was just a little peanut, like, man, we were blown up at doctor's office. Like we were there constantly because I was just so nervous, but she was also a pandemic baby. So I was just extra nervous for that whole thing. But at any rate, yeah, kids get sick, and which, I mean, yes, they're kids, so their bodies can fight things off a bit faster, but sometimes that's not always the case. And you can be in a position where you're going to have a long extended hospital stay, and that can be very complicated and very costly. So it's nice to have some type of coverage for that. So with that being said, because this is a Newcomers Community Forum and for the immigrant refugee population explicitly, I was just curious how like insurance and things like that are received in your respective communities. Is insurance something that's important, do you think? Is it something that people understand? I know for me personally, insurance is very confusing. I just know that it covers the cost of stuff, but I was just curious if anybody would be willing to share their perspective.
I can share a little because during the time of when I first started working with Monsoon, so like what I did before even doing direct services stuff, I was doing the helping community members like enrolling Medicaid, like as part of my community engagement. And
Sure,
so
yeah.
I would always like refer them to VNA over here, because I know they help with like insurance stuff, applying for Medicaid. If not with them, then through Crescent Health Clinic here in Dubuque too. And so like how does the process work is that during the time of their application, when they're applying for Medicaid, they already have like the presumptive coverage, right? So they'll have that temporary coverage in the meantime that they wait for their Medicaid to process and everything. So I think I was gonna ask that, but I think she disappeared.
Yeah, she disappeared. She'll be back.
Process for Hawkeye as well, but I know it's probably different.
And I do know, so she also works with presumptive eligibility kind of stuff as well. So it's like twofold, like her position. So she's just the Hawkeye coordinator, like that's her title, but yeah, she does presumptive as well. So, and in fact, I'm going to give her a quick call to kind of see if we can troubleshoot what's going on here. So give me just a second. Okay, so Sanela thought she was still on the call. So she's been talking for the past like 10 minutes to no one. So we're gonna have her call in, but yeah, thank you so much for that input there, because it is a very pertinent topic. It's a very important topic to be discussing for sure. Are there other experiences that anyone wants to share while we wait for Sanela to tune back in? All right. Yeah, and I think that the nice thing with Hawkeye specifically is that it's nice for those people who are like, I feel like a lot of folks are in this income bracket where they make too much, but they don't make enough. And so it's nice to address that area for income stuff, because those people need help too. So I like how Hawkeye has a higher poverty level for oh goodness. Okay, just a second. We are just having a grand old time at Blackhawk County Public Health today, everyone. It's great stuff. So yes, I like how it addresses that income gap there. That's really nice. So yeah, and I believe, if I understand correctly, like I said, insurance is confusing, but the insurance plans get mapped out to MCOs, and so it's either AmeriGroup or Iowa Total Care right now. And you got to kind of pay attention to that kind of stuff though too, because sometimes those MCOs flip around. Like I know when I kind of started in social work, it was United Healthcare was the one, and then it was AmeriHealth, and then also AmeriGroup. Like there were 3 of them, I think. So it just keeping up with all that has been interesting over the past few years that I've been doing this. So. But yeah, currently it's AmeriGroup and Iowa Total Care. And then Delta Dental, I believe, is the dental program. And they're the dental program for a lot of people as well. So yeah. Hi, Crystal. And Julie, can you hear us okay down there?
Yes, I can hear you guys.
Okay, awesome. I didn't know if you had any input based on insurance within your community.
Oh,
I'm back.
Oh,
okay. Thank you.
all right. Well, we'll put Julie on hold. Okay, Sanela. So we kind of lost you at this point. It's been about 15 minutes, give or take, or so it feels like. So we were discussing kind of presumptive eligibility, and I know you have some knowledge on that. Ayoko, God bless America. Tell me again how to say your name. I'm gonna get it.
You got it right.
Did I really, Ayoko?
Yeah.
Good job, self. Okay, Ayoko has a question regarding presumptive, I believe. So.
Okay.
Yeah, I was just wondering, like, as far as that, like, do you get it right away after applying for Hawkeye, or how does the process work?
Presumptive?
Yes.
So actually what we do, we apply for presumptive, and that would be before Hawkeye. So Hawkeye would come just like Medicaid. So we apply for presumptive, and then you find out right after like application is completed, you find out if a child qualified or not. If child qualifies, then there's like a 30-ish days where they would have like a temporary coverage. Meanwhile, DHS would decide if they qualify for Medicaid or Hawkeye.
Okay. Okay, thank you.
Mm-hmm.
Okay, and then we also had another question in the chat box. Is the Hawkeye application the same as the Medicaid application?
Yes, excited. Hey, I already talked about it when no one was listening. Oh no, nobody could hear me.
Yeah, you just vanished from the screen. It was like you just went poof. You just disappeared.
I'm so
So take it
sorry.
away. You got this.
So yes, for Hawkeye or Medicaid, it would be the same application. You just fill everything out. Once they receive your application, they would look at the income guidelines and family, like usually family size and income. So if they determine that you do not qualify for Medicaid because you make too much, then they would look at the income guidelines for Hawkeye. And if the child is within like those income guidelines, then they would automatically place the child on Hawkeye. So there's nothing like you need to do like different. It's just the same application. Everything goes the same. They just let you know at the end.
Okay. And then another question is, does Hawkeye cover vision care? That's a good one.
Yes. So I'll just tell you, like, also that part I covered. So services that are covered: doctor and well child visits, inpatient and outpatient hospital services, vaccines, including immunizations and prescriptions, ambulance services and emergency care, vision, dental, and hearing exams, specialists, chiropractic care, mental health, substance abuse care, and more.
Okay, awesome. And then regarding the vision insurance, I don't know if you know the answer to this, but who is the insurance provider for that? Is it a Visas or?
Honestly, it doesn't really, it doesn't say the same thing, like dental would be Delta, but it doesn't specify.
Oh, interesting. I know because I actually used to work in the vision care field for about a year or so. And I know that some places accept certain insurances similar to like medical stuff. So I was just curious about that. Another question is, does Hawkeye assign you to a provider after 90 days like Medicaid, or can you go to any provider you want?
Hawkeye is accepted mostly just like Medicaid by many providers, including actually some of the providers accept Hawkeye but not Medicaid. So I think it's a little bit like a bigger variety. But just to make sure, you would want to like check with the doctor that you are going to, a provider.
Yeah, I think that's the biggest thing too, is like encouraging any families that you work with just to call ahead of time to like verify what services are covered and stuff, because even like certain plans can be different, because I think are there levels to Hawkeye, or is it just one plan?
Just one.
Oh, it's just okay. So yeah, but just inquiring ahead of time just to make sure that something is covered. And I don't know, I know for me, sometimes like with my insurance stuff, I get a little nervous to like call the insurance provider because I'm just like, I don't know if I know what I'm talking about. And it can be kind of like a nervous thing to do, but I think it's important to advocate for that, and especially your own health and that of your kid, right? So you want to make sure they're getting the best possible services. So just not being afraid to ask questions and calling those appropriate numbers. So, but I can also understand how that could be intimidating at times as well. So.
Yes, definitely. But a lot of times, like, they're pretty easy if you call like just receptionists, they'll tell you, because they deal with that every day, and they would be able to tell you if like Hawkeye is accepted. And like I said, it's a lot, I shouldn't say a lot more accepted, but it is accepted in like a lot of places, even some that like, I'm talking about more like a dental providers. Hawkeye is accepted more than really Medicaid.
Sure, yeah. Well, that's good. Okay, do you have a question? Oh, go ahead.
Oh, sorry, go ahead.
No, you're fine. Go ahead.
You didn't hear me when I was earlier when I was mentioning like how do you qualify? There are some requirements. You have to be under 19. So Hawkeye only covers kids to 18, from birth to 18. You need to meet Hawkeye income guidelines. Also, there are guidelines, as I mentioned earlier, just they're higher. You have to be a U.S. citizen and have qualifying immigration status, and you cannot be duly enrolled with other health insurance. So like Medicaid, sometimes like it could be a secondary. You can have private and then have Medicaid in secondary. Hawkeye, you can't do that. So you can only be Hawkeye.
That's good to know. So you can't double dip or whatever.
Yeah, no.
Okay. That makes sense. So I put this
And then
visual up here too, Sanela, if you wanted to chat about that, if you can see it.
I can't see anything.
Oh, geez.
Sorry.
Okay, well,
Yeah.
I will talk about it quick. It's just kind of reviewing what we've kind of already discussed, but applying, for those interested in applying, you can just go to the dhs.iowa.gov/Hawkeye or call this 1855 number here. And as Sanela was saying, eligibility is under age 19, you meet the income guidelines, you're a US citizen or have qualifying immigration status, not duly enrolled with another health insurance, and these are all the covered services. So again, we have vision, dental and hearing exams, specialist chiropractic care, well child visits, which as the First 5 site coordinator, I'm all about those well child visits, making sure you're taking your kiddo in, and you have quite a few to go to in the first few years of their life, but it's important. And then the doctors that accept Hawkeye, again, we kind of already discussed this, but the health plans are through AmeriGroup of Iowa and Iowa Total Care. But again, making sure you ask the provider if they accept your insurance before receiving the care is very important. But Sanela is here to answer those questions. She's in the office and you can just give her a call too. So, and another thing, flip side, does informing apply to Hawkeye at all, Sanela, or am I making that up?
No, it's
No.
not part of
Okay.
Hawkeye.
Okay, then we won't go into that.
Yeah, and if you do have any questions, like you can call. Do you have my direct phone number posted?
Yep, I have the 2211.
Okay, yeah. If you have questions, you're not sure, you can feel free to call me or leave a message. If I don't answer right away, I will return the call. There's also a question about it says my children are healthy. Do they really need health insurance? Well, the answer is yes. Accidents and illnesses happen, and without health insurance, medical care can be very expensive. So it is important that you do have insurance for your child.
Bingo. Another question that we have is, do they review the income status of the family yearly?
Yes.
They do. Okay. So if a family were to have, I don't know, like 40,000 in January, but then if they're making like $90,000 come November, they won't have to report that income until the following year.
So DHS wants you to report changes as soon as you have changes. Now it's up to you to do that, or when you're going to do it. But they really would want you. So sometimes when you have, you would see, it could happen that your child goes from Medicaid to Hawkeye or going back and forth. It would be based on your income change or changes of income and family size. That's also possible. So I did have with my other program of informing where child would be switched back and forth. Oh, my child had Hawkeye. Why am I on Medicaid again? Or it would be based on your changes or yearly report.
Okay, that makes sense. And you're just answering these questions, man. You're doing great. It's like rapid fire.
I try.
Awesome. Other questions or other thoughts on insurance stuff?
So one people can keep two insurance, Hawkeye and Medicaid both.
I'm sorry, I could not hear clearly.
My question is, so it means one person can keep Medicaid and Hawkeye both?
You can't have both because Medicaid would be a first one. If you make too much for Medicaid, then they would place a child on Hawkeye. Or if you make more than Hawkeye, is that
yes.
a question?
And I think
because I find out some people when they approve from the Hawkeye and because of some income increases, then they apply for Hawkeye. Sorry, some people they have Medicaid form, and then when their income goes a little bit increase, and they apply for Hawkeye, and after that they forget to cut off the Medicaid, and sometimes they have both. So in that case, how you guys do? You guys cut off by yourself, or the people need to inform you?
When you you can only have one at a time. And it could be that kid was on one and then switched to the other one, but you can't have both. Now, you can have two in a family if you have, let's say you have infant and, or like you just had a baby, and those income guidelines are a little bit different than regular Medicaid income guidelines. So it could happen that for just a short period of time, you would have a baby on regular Medicaid and other kids on Hawkeye.
Awesome. Thank you so much.
You're welcome.
Yes, all these like little like nuances is important because everyone's situation is different. So
Yes,
yeah.
definitely.
Mm-hmm. Okay, awesome. All right. So yeah, again, as Sanela was saying, and I kind of touched on this earlier, but insurance is super important, especially for those youngins, for those little kids, because they're more likely to get sick. We want to ensure that they are getting quality health care, especially in their growing years. And with like their weaker immune system, they are going to get sick more frequently, especially. And I think I heard not like a full out statistic the other day, but like the 0 to 2 year, like from a child from birth to age 2, they're just sick a lot. And that's a very normal thing because their bodies are being exposed to a lot of different things as they're growing from birth to 2 years old. So that's just something to be aware of. So again, yeah, it's nice that Hawkeye exists, and that's provided through well, I believe it's IDPH, but we are the Blackhawk County Public Health. We are the local for this area. And Sanela, you cover Blackhawk, Bremer, Buchanan, and Grundy, correct?
Yes.
That's your specific region. Okay. So yeah, any questions about Hawkeye can go there. I will put Sanela's contact info in the chat here. So again, that's 319-292-2211. That's Sanela's contact information if you have questions. And Sanela also, for those who work with any of the Hispanic population, Sanela does speak Spanish as well. So. Okay, so this one was just kind of short and sweet. We had some technical difficulties, but we got through it.
Oh my God.
We're still here.
I'm so sorry about that.
I'm excited though to see some new faces. This is exciting. I'm going to go ahead and stop the recording.